Hello everyone, welcome back to the question answer discussion session. So today's question is, which of the following part of nephron is the site of action of thiazide diuretics? A choice PCT, B choice descending LH, C choice ascending LH, D choice DCT, and E choice collecting duct. So before coming to the correct answer, let's understand a few points about diuretics. So diuretics are basically they are drugs which increases the volume of urine formation. So they are drugs which increases the volume of urine formation. They are also drugs which increases the rate of urine formation. They are also drugs which increases the loss of sodium as well as water in the urine. So this is the important point of diuretic. They increases the volume of urine formation, they increases the rate of urine formation, they increases the loss of sodium and water in the urine, and mainly used in the treatment of edema, pulmonary hypertension. Now diuretics are drugs which acts on the kidney to increases the urine formation. So in the part of the kidney where diuretics act is called as nephron. So as you all know, nephron rough diagram of nephron will look like this. So this area is called as the Bowman's capsule. Glomerulus is here. This is called as the Bowman's capsule. This horizontal part is called as PCT or proximal convoluted tubule. This U-shaped region is called as loop of Henle, LH or loop of Henle. In the loop of Henle, this downward portion, this is called as the descending loop of Henle. Descending loop of Henle, whereas this part is called as, or the thick part in the loop of Henle is called as the ascending loop of Henle. Now this horizontal portion is called as the distal convoluted tubule, and this portion is called as the collecting duct. So the filtration will happen through these tubules, and the urine will be coming out through this. Okay, now so this is the rough diagram of nephron. Now the diuretics which acts on this nephron has specific site of action. Now mainly the important diuretics are, number one, the weak diuretics like carbonic anhydrase inhibitor. It's a weak diuretic. One of the main example is acetazolamide. So carbonic anhydrase inhibitor like drugs like acetazolamide mainly act on the proximal convoluted tubule. Now coming to the second important diuretic, that is also a weak diuretic called as the osmotic diuretic. Osmotic diuretic, one of the main example is mannitol, glycerol, etc. So osmotic diuretics mainly act on the proximal convoluted tubule plus this descending part of the loop of Henle, that is descending loop of Henle. The main site of action of osmotic diuretics are the descending loop of Henle along with the proximal convoluted tubule. Now coming to the third important diuretic, that is the loop diuretics. Loop diuretic is also called as high ceiling diuretic, or it is also called as high efficacy diuretic. The main example is furosemide kind of drug. So they are strong diuretics, they are high efficacy diuretic, and the site of action is this thick part of loop of Henle where the maximum reabsorption happen. So the site of action of loop diuretic is ascending loop of Henle. Ascending loop of Henle, where descending loop of Henle is the site of action of osmotic diuretics, where ascending loop of Henle is the site of action of loop diuretics. Now coming to the fourth important diuretic, that is the medium efficacy diuretics called as the thiazide diuretics. One of the main example is hydrochlorothiazide. hydrochlorothiazide. So hydrochlorothiazide acts on this part called as the distal convoluted tubule. So the main site of action of thiazide diuretic is distal convoluted tubule. In fact, the thiazide diuretic mainly act on the early part of distal convoluted tubule. So the site of action of thiazide diuretic is early distal convoluted tubule. Now coming to the last important diuretic, that is the potassium sparing diuretics. Potassium sparing diuretics. Examples are spironolactone. Main examples is spironolactone, then amiloride is there, triamterene is there, triamterene. So the site of action of potassium sparing diuretic is the late part of distal convoluted tubule. This part, the late part of distal convoluted tubule, along with the collecting duct. So the site of action of potassium sparing diuretic is the late distal convoluted tubule plus the collecting duct. Okay, now coming back to the question. Which of the following part of nephron is the site of action of thiazide diuretic? We have told that the early distal convoluted tubule. So the correct answer is D choice, distal convoluted tubule. Proximal convoluted tubule, the main the drugs which act on the PCT is mainly the carbonic anhydrase inhibitor. Descending loop of Henle is the main site of action of osmotic diuretics. Ascending loop of Henle is the main site of action of loop diuretics. Collecting duct is one of the main site of action of a potassium sparing diuretic. Thank you.